guys, welcome to today's video. And today we have a daktari here, and we would like to know what he has for us today. Welcome, daktari.
Yes. Kwa watazamaji ningependa kuwakaribisha kwa hii channel, na kama huja subscribe, please subscribe, like na comment kwa hii channel. Mimi ni daktari, naitwa Eric, na leo tunaenda kuongelea about arthritis. Arthritis ni inflammation na stiffness ya joints. Inaweza kuwa ni joint moja ama nyingi. Inaweza kuwa ni joint ya mkono, ya mguu, pali tu joints, pali bones zinakutana, kunaweza kuwa na inflammation which inakuwa arthritis. So ukiwa na uchungu kwa joints, kunaweza kuwa na arthritis.
Okay, thank you. What else, daktari, apart from arthritis yenye inafanya our bones still stiff and also inflamed?
Sasa kwa hizo nini, tuko na types za arthritis. Kuna kuwa na type ya kwanza ni osteoarthritis, where the joints inflammation, kuna kuwa na joints. So kunaweza kuwa na wear and tear ya joints hizo cartilages. Cartilages ni zile vitu zinatusaidia kwa joints kukiwa na pressure, ama kukiwa na maybe pressure kwa joint, maybe due to overweight, kuwe na hapo na pressure ama shock kwa hiyo joint. So hiyo cartilage ina absorb hiyo pressure na hiyo shock, so you don't feel pain. But kama kuna inflammation, then you are going to feel that pain. So osteoarthritis just the wear and tear of the cartilage and the inflammation ya hizo cartilage, and also reduction of the synovial fluids. In the second type, we are having rheumatoid arthritis. Rheumatoid arthritis is when the immune system fight the cartilage. When your immune now fight the cartilage, you get that there is a inflammation. So your immunity starts to fight your own body. So the body immune fights the tissues. For the third type, we are having gout. Gout is just the accumulation of uric crystals around the joints. So this is the type when people who take a lot of alcohol, they eat nyama choma. So you find those crystals, they accumulate in the joints. So you find the patients gets the pains around the joints. So that was the type 3. There is the fourth type, psoriatic arthritis. Psoriatic arthritis, we get infection of the skin around the joints. So around the joints, you find there is skin infection. So this skin infection, it affects the joints. So you find you get arthritis through the infection of the skin. Then we are having the fourth type. The fourth type.
Yes, the fourth type.
The fourth type is calcaneus spurs. You get there is a overgrowth of the bone around the heel. So if there is the growth, when you apply more pressure on that bone, you get there is a transfer of pain around the joints.
Okay. So, daktari, I would also like to know how do we diagnose all these types of arthritis?
So in diagnosis, we are having two major areas, which is lab. Lab, we do a blood rheumatoid factor. Rheumatoid test, you get that it is positive. If you are positive, you are having the arthritis, you are having the infection of the joints. And if it is negative, you can have a negative, yes, but you are having the arthritis. One, we say that it is wear and tear. So wear and tear, you might get it's negative,
Yes.
But people who do athletics, because of that pressure and also overweight, or when you are running, you can get there is a injury to the cartilage. So you are going to have that arthritis.
Okay.
And then we do imaging. Imaging, we can do CT scan around the joints. We can do MRI. We can do ultrasound. So imaging, it's a further investigation, just to do management. And also we are going to talk about symptoms and signs,
Yes.
and also the causes. So symptoms and signs, where the patients come with the pain of the joints, stiffness, redness of that joint, and also swelling. You get that the patients come with swelling, and also you get they can't walk.
Okay.
Because of those signs. The causes, you get that is injury. We said that also athletics can also cause, because you are using that joint so much, so you get that one. You can also get through bacteria infection.
Yes.
To the joints.
Okay.
Injury to the joints.
Yes.
Also risk factors, like family. If your family had this history of arthritis, you can get old age.
Yes.
Old age, because this one was an infection that was left for the
old people. Yes.
But we are getting it to the
young
younger age.
So it's because it can also be a family thing.
It's a family thing.
Okay.
Age is also changing. It is not now. It is for the young, for the old. You can get also, and then to the gender, female, they are more to the because of weight. We talked about the weight.
So women are the most vulnerable to this arthritis.
To the arthritis.
Okay. Okay, thank you so much, Daktari. Now, since we have known the signs and symptoms, the causes, the diagnosis, do arthritis have treatment, Daktari?
So on the treatment,
yes,
there is treatment. You can be treated, and the treatment it is divided into different sections. So the first one, we start on lifestyle. Yes. Like we said, you monitor your weight. If your weight, you monitor your weight and modify it, you are going to manage this arthritis. So weight you reduce, and then you can also reduce drug abuse, yes, like alcohol, tobacco smoking, chewing of mirror. Those one it is going to help you. You take a lot of fluids, yes, to increase the synovial fluids. Then you nutrition, those supplements, yes, like Vitacal, calcium, also vitamins. You can take to at least to make your bones healthy and strong. Okay. And then you can also reduce pain, analgesics. Like you can NSAIDs. You can also. So
painkillers, you are not supposed to be taking them
too much, because they can also bring the other complication. You can treat arthritis and get another complication like peptic ulcer disease, like brufen. You are going to take an NSAID. With steroids. Steroids are the most dangerous drugs. Yes. And it is killing our patients. You should not put your patients on steroids for so long. Okay. Like
so, Daktari, let me cut you. Since you have said about steroids, to tell our viewers, what are these steroids?
Steroids
examples.
Steroids are the drugs that reduce the inflammations. Okay. And this one is prednisolone. Yes. Like patients, you cannot put a patient on prednisolone for 2 weeks. Okay. That one because our body produces cortisone that helps in production of those steroids. Yes. So if you have more steroids in your body, yes, you are telling your body not to produce. If you stop taking these steroids, your body will not
produce.
produce.
Okay.
So they are going to relax because there is more steroids in the body.
Okay.
So you should make sure that you don't please, if your patient has no inflammation
Yes.
in the joints,
Yes.
never put your patients on steroids.
Okay.
Because the patients recover more on steroids and they cannot do without steroids.
Okay.
So, and that one is what we are major stressing. Never put your patients on steroids for so long, because they benefit and they cannot do without.
Thank you so much, Daktari. So thank you so much, Daktari, for the inward information that you have given us about arthritis. Anything else you want to add, Daktari?
So to our viewers,
yes,
we are going to get educated in this channel, and follow me in this channel, because it's a medical and modification of lifestyle. So just subscribe, comment, and like and follow me in this channel. Thank you.
Thank you so much, viewers. Have a good day and kudos.
Daktari.